This is Jennifer Creekmer, Improvement Advisor at Iowa Healthcare Collaborative. This recording is on the Hospital Engagement Network, or HEN, measurement of surgical site infections. Looking at this measure, if your hospital does 10 or less of any of these surgeries, this reporting does not apply to you. The four areas that we're looking at is abdominal hip, knee, and colon. There are 4 outcome measures and 2 process measures, one of which is required. Zero denominator is allowed. The data source that we get this information from, 4 of them come from NHSN and 2 are self-reported. Going to the toolkit to look at surgical site infections, we start with the description and the rationale. Then we go into the 4 outcome measures. Again, they're colon, abdominal hysterectomy, hip replacement, and knee replacement. All of this data does come from NHSN data. Going down to the process measures, we do have 2. Both are self-reported. The first process measure, surgery patients with perioperative temperature management. Numerator, number of surgical inpatients for whom either active warming was used intraoperatively or who have had at least one body temperature equal or greater to 96.8 within 30 minutes immediately prior or 15 minutes immediately after anesthesia end time. Denominator, number of surgery inpatients undergoing the procedure under general or greater than equal to 60 minutes duration. The second process measure that we have, surgical safety checklist compliance. This is the number of days in the month in which the checklist was used in all cases. The denominator, number of operating room days in the month. Zero denominator on both of these is allowed, and they are both self-reported, and you can sample on these. So you can choose a day for the surgical safety checklist compliance. You can choose a room to monitor. Looking through the resources, again, we have the HRAT Top 10 Checklist, which gives the best evidence-based information to see if your hospital is using these. We also have CDC's surgical site infection code list. These codes are ICD-9 and ICD-10. We have an example of the WHO Patient Safety Surgical Safety Checklist and the implementation manual. And then we have some other information that will be helpful to you as you use this. If you have any questions on the surgical site infection measure, please contact myself or Jennifer Brockman.